We will, of course, prioritize testing for states that are showing a high positivity rate right now and also a relatively low vaccine coverage. And these are the states that I mentioned: Perak, Terengganu, Johor, Kedah, Kelantan, and Sabah. That's why there's a sense of urgency for testing and vaccination in these states, as well as some other measures that we have implemented in the Greater Klang Valley Task Force. But be that as it may, it does not mean that we will reduce our testing capacity in other states, because most states are still having a positivity rate of more than 10%. So we have always emphasized on testing, but we want to do testing in a targeted manner. We repeated this again and again and again, so that we make the best yield from the resources that are available. We are also working together with the private sector. We are trying to encourage companies to come forward and test their employers. We cannot rely 100% on government testing. This is where employers, if they want to start opening up their businesses, they have to step forward to provide testing for their employees, especially those who are symptomatic and those who are sick. They must do that. Saya juga ingin memaklumkan bahawa ada berita baik hari ini, mana saya akan minta Menteri Perdagangan Dalam Negeri dan Hal Ehwal Pengguna Umum dalam masa yang terdekat. We have set a ceiling price for rapid test kits. We have decided in Cabinet today to set the ceiling price. The ceiling price has been set, and Datuk Sri Alex Linggi will be announcing that very shortly. Secondly, on the 6 million additional doses, of course, KKM and also JKJAV thanks the Prime Minister for the very important announcement to announce this buffer supply stock. So for the time being, we will consider when to exercise that, now that we know that the allocation is there. At the moment, our vaccine schedule for September seems to be quite adequate. But if there are any shortages and if there are any disruptions to the supply, then we will exercise the option that Prime Minister has announced. For the month of September, we will be allocating to the states 15.16 million doses of vaccines. And the states that will be receiving the most vaccines will be Johor, 1.9 million, Kedah, 1.3 million, Kelantan, 1.2 million, Pahang 1.4 million, Perak 1.6 million, Penang 1 million, and Sabah 2.9 million. This is to allow for the states to catch up this month.